The subunit organisation of the liver is very difficult to observe because the amount of connective tissue between lobules is minimal and the lobules are randomly orientated. Actually, the section of liver looks pretty uninteresting, but it is never easy to discern randomly sectioned lobular structures in pieces of liver such as this one. But within this image, there are portal areas of connective tissue containing branches of the portal vein, hepatic artery, and bile duct. And central veins are sitting by themselves among the hepatocytes. I certainly don't expect you to be able to distinguish these at this low magnification, but I will show you details of these characteristic components of the liver in a few images that will now follow. This is a portal triad, which would be located at the periphery of the lobule and is a branch of the portal vein, hepatic artery, note the single layer of smooth muscle cells in the tunica media, but this can be a thicker layer in other portal triads, and the bile duct with a simple cuboidal epithelium. The central vein will be located in the centre of the lobule and has little more than a sheet of endothelium for its wall. See the flattened nucleus of an endothelial cell here and here, with a minimum of connective tissue, which is collagen, that is not really resolvable that clearly here. The parenchyma is composed of irregular lines of hepatocytes, which look like cords of cells. The real arrangement in 3 dimensions is that of anastomosing sheets of cells. Between these sheets are blood sinusoids, with the flattened nuclei of the cells lining them. They belong to endothelial cells and to Kupffer cells or macrophages. Very important metabolic exchanges occur directly between the hepatocytes and the blood in these sinusoids. Hepatocytes secrete many compounds from glucose to serum proteins into the blood. To facilitate this endocrine secretion, the expected basement membrane of both the endothelial cells lining the sinusoids and the hepatocytes themselves is absent. And without this glue, a narrow space called the space of Dis develops between the two epithelia. But again, this is not resolvable in this image. The liver is also an exocrine gland, with bile as its exocrine secretion. Every hepatic cell is in contact with at least one bile canaliculus, which it secretes bile into. These canaliculi form an anastomosing network which eventually drains into a bile duct in the portal area. The canaliculi actually are very narrow channels between every 2 adjacent hepatocytes and do not have any other wall of their own. Again, they are too tiny to resolve here, but you can imagine where they would be located. And I'm now using the pointer just to show you 2 locations, one here and another one here. And if you look very carefully, you'll notice that there is this slightly reddish region between the 2 hepatocytes. That would be where the bile canaliculus would be located between these 2 respective hepatocytes.